My name is Krishna Misriya. This is my student ID, and I am going to be doing a head-to-toe examination for my final practical exam. So I am in section KCC of PNE 203. I'm going to begin by doing a 360 of the room. Okay. To begin, I am going to start off by doing hand hygiene. And donning my gloves. And I'm also cleaning my stethoscope, both the bell and the diaphragm. Okay, to begin with, this is my patient. My name is Krishna, and I'll be your student nurse for today. Before we get started, can I please confirm your name?
Billy.
And I see that it matches your wristband. And before we get started, would you like to use the washroom?
No.
And are you comfortable?
Yes.
And are you in any pain?
No.
Okay, I'm going to be drawing the curtains for some privacy. Starting off with my patient's physical appearance. My patient appears to be the stated age, and their skin color is appropriate according to their genetic background. Now I'm going to move on to my patient's physical appearance. Can you please stand up? So upon inspection, my patient's body is symmetrical, and it's proportionate. My patient's height appears to be the same according to their age and genetic background. Please sit down. My patient's posture is, my patient has good posture. They are able to sit comfortably in the chair with their arms relaxed. My patient is able to also maintain eye contact, and they are dressed appropriately for the weather. My patient's t-shirt, hair, and everything, they seem to be groomed well, which means their hygiene is intact. Patient has good posture, and also there seems to be no signs of any physical deformities. Moving on to my patient's breathing. My patient is breathing well. There seems to be no signs of distress. And my patient's level of consciousness. I'm going to ask you, what is your name?
William.
Where are you?
Hospital.
And what month are we in right now?
April.
So my patient is alert and oriented ×3 to person, place, and time. Moving on to my patient's head inspection. My patient's facial features are symmetrical on both sides. There seems to be no droopiness. There is also proportionate to my patient's body. Moving on to testing cranial nerve number 7, which is the facial nerves. I'm going to ask the patient to raise your eyebrows, frown, smile, show your teeth, okay, and close your eyes tightly. I'm going to also tug on them. Perfect. This means that cranial nerve number 7 is intact. Moving on to my patient's eyes. As you can see, my patient's eyebrows are symmetrical. Eyes are also even and symmetrical and proportionate. My patient's eyelids are intact. My patient's eyelashes are evenly distributed on both the upper and lower eyelids. My patient's sclera is white in color. There seems to be no discharge or crustiness around the eyes. I'm also going to be checking their conjunctiva now. I'm going to ask you to look up, please. My patient's conjunctiva is pink in color, and there seems to be no abnormalities there, and that looks intact. Now I'm going to be testing cranial nerve number 3, which is the oculomotor nerve. First, checking my patient's pupil size. So as you can see, my patient's pupil size are 3 millimeters in diameter, and they are round in size and equal bilaterally. I'm going to be doing a light reflex test to check both concentric and direct light reflex test. Okay, so I'm just going to be flashing this in your eyes, okay? Straight ahead at the camera. So my patient's pupils were able to constrict and dilate upon both consensual and direct light reflex test. Now I'm going to be checking my patient for accommodation. I'm just going to ask the patient to look at the pen as I move closer towards their nose. Keep your eyes on the pen. So my patient's eyes were able to converge as I brought the pen closer towards their nose. They also were able to dilate, and that accommodation is intact. Moving on to my patient's ears. My patient's ears are of appropriate size and shape for my patient's body and genetic background. There seems to be no discharge on either sides of the ears. Moving on to my patient's nose. My patient's nose is midline and centered. There is no abnormalities found there. Checking their sinuses, there's also no discharge or abnormalities found there. Moving on to my patient's mouth and pharynx. Okay. My patient's lips are pink in color and they are symmetrical and proportionate according to my patient's facial features. There is also no signs of hydration. My patient's lips are well hydrated. And I'm going to be testing cranial nerve number 9 and cranial nerve number 10, which is the glossopharyngeal nerve and the vagus nerve. I'm going to be asking the patient to say, open your mouth, please. And when I say so, please say ah. Okay, so my patient's uvula and soft palate was able to rise up and move back, which means cranial nerve number 9 and 10 are intact. Now I'm going to be testing cranial nerve number 12, which is the hypoglossal nerve. I'm going to ask the patient to open their mouth again and stick out your tongue. Move it side to side. Perfect. So my patient was able to move their tongue side to side, and also their tongue is midline. And now I'm going to ask them to say light, tight, dynamite.
Repeat.
Light, tight, dynamite.
Light,
Tight,
tight, dynamite.
light, tight, dynamite.
Light, tight, dynamite.
Perfect. So my patient was able to say light, tight, dynamite with no tremors, which means cranial nerve number 12 is intact. Moving on to my patient's neck. Starting off with the color. My patient's skin tone is consistent throughout the body. There seems to be no lesions, scars, masses of any kind. Upon palpation, do you feel any pain?
No.
There is no pain and there is no tenderness. And upon touch, my patient's temperature is warm and moist. Moving on to checking their carotid, palpating their carotid artery. I'm going to be doing 30 seconds on both sides. Okay, so I'll be I checked their carotid artery on both sides. I palpated the carotid artery on both sides. It was equal bilaterally. Their rhythm was regular, and I would say the strength would be of +2, and equal bilaterally. Moving on to testing cranial nerve number 11, which is the spinal accessory nerve. I'm going to ask the patient to rotate your head. Okay, shrug your shoulders. And now shrug your shoulders against resistance. Okay, my patient was able to do so. And shrug their shoulders against resistance, which means cranial nerve number 11 is intact. Moving on to patient's upper extremities. I'm going to ask the patient to put out your arms. Okay. As we can see, the patient's skin tone is consistent throughout the body and it is appropriate according to their genetic background. There seems to be no lesion scars upon appearance. Now I'm going to be palpating. Let me know if you feel any pain. Any pain?
No.
Perfect. So there was no pain or tenderness upon palpation. I felt no masses or lesions or scarring of any kind. Now I'm going to be checking their radial pulse on both arms. Please, with your both arms. And I'll be doing this for a minute. So my patient's radial pulse is 60 breaths per minute. The rhythm is regular and strong and equal bilaterally on both arms. Now I'm going to be doing a grip test check. I'm going to ask the patient to grip onto my arms. Perfect. So the patient was able to grip onto my arms equally and bilaterally with the same amount of strength coming from both arms at the same time. Now I'm going to be checking their lower extremities. Just ask you to, yeah. So upon inspection, patient's skin tone is consistent throughout the whole body and it is appropriate according to their genetic background. There appears to be no lesion, scars, or masses of any kind. Now I'm going to be palpating. Let me know if there's any pain or discomfort. Any pain or discomfort?
No.
Perfect. So upon palpation, there was also no lumps, edema, or swelling of any kind noted. Moving on to my patient's thorax, posterior thorax. I'm just going to ask you to... Okay, so upon inspection, again, the skin tone is consistent throughout the whole body. My patient's skeletal appearance seems to be symmetrical on both sides. There seems to be no abnormalities in their physical appearance from the back. My patient's skin is warm to touch and there seems to be no lesion scarring or any of those kind. I'm going to be assessing for their chest expansion. So I'm just going to ask you to breathe in and out, please. Okay, my patient's chest was able to expand, and my hands were able to move away and back when they were able to do chest expansions just fine. Now I'm going to be auscultating on the 12 landmarks, and every time my stethoscope moves, please take a deep breath in and out. Okay. In, out, 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 in, out. So I'll be doing, I auscultated on both sides bilaterally on 12 landmarks. There were no signs of any wheezing, brewing, or abnormalities when listening to their posterior thorax. Now I am going to be checking their anterior thorax. You can please position yourself in. So checking their anterior thorax, it is symmetrical on both sides. Skin color again is consistent throughout the whole body. And I'm going to be checking for their respiration rate, and I will be doing this for a minute. Okay, so their respiration rate is normal. It is 60 breaths per minute, and patient's respirations were relaxed and there was no signs of distress. Now I'm going to be checking their cardiovascular. I'll be auscultating the mitral valve, which is in the 5th intercostal space of the left midclavicular line, which would be pulmonary which would be right around here. For 30 seconds. Oh no, it's okay. Okay, so patients, it was 60 breaths per minute, and there was no extra sounds in S3 and S4. There was no sounds of any brewing or wheezing of any kind. And now we're going to be doing a abdominal assessment. So I'm just gonna ask you to come lay down over here, please. Yes, and I'll be draping my patient. Sorry, it's short. Yeah, I'll be draping my patient for some privacy. Is it okay with you if I lift up your shirt? Okay. Okay. Yeah, that's fine. Okay. So now I'm gonna be auscultating the abdomen in all 4 quadrants and checking for bowel sounds. Starting off with the lower right quadrant. And now the upper right quadrant. And the upper left quadrant. And then the lower left quadrant. And bowel signs were present in all 4 quadrants, and I'll be checking. Also, I'll be auscultating each quadrant for 5 minutes, and bowel sounds were present in all 4 quadrants. Now I'm going to be palpating all 4 quadrants. Let me know if you feel any pain. So the lower right quadrant, upper left quadrant, upper left quadrant, and the lower right quadrant, left quadrant, sorry. Upon palpation, there was no masses, there was no edema, and there was no tenderness. And yes, we are done. And now we're just gonna be waiting for your physician to come in. Before I leave, can I get you anything?
Just water.
Okay, sounds good.